Good day, guys. I hope everyone is ready for this mind-blowing lecture. Today we'll be talking about the sickle cell anemia. I'll be talking about the sickle cell anemia pathophysiology. Okay, that's the causes of this disease and how this disease can be managed. Okay, and how to tell if a patient has sickle cell. Okay, so this is the MBBS Niger. Do subscribe to our YouTube channel. uh, Search us on Facebook, MBBS Niger, and like our page on Facebook. Let's proceed, guys. What is a sickle cell anemia? We'll say that sickle cell anemia is an inherited blood disorder. This is characterized by sickle cell shape. Okay, and your red blood cells are not biconcave in size, okay, or in shape, but they are rather sickle cell, okay. They are shaped like a sickle. This is also called hemoglobin SS disease, okay, or sickle cell disease, and it is common in people of African origin. Sickle cell is very common in Africans, okay. So let's proceed. This is just a picture showing the normal red blood cell and showing the sickle red blood cell. And you could see the sickle red blood cells hooking on the walls of your arteries, okay, and your veins. And this is the wall of the blood vessel. And you could see the sickle cell shaped blood cells hooking on the walls of the vessel. Hence, there is no smooth flow of blood. All right. So what is the pathophysiology of sickle cell anemia? We could say that the pathophysiology of sickle cell anemia, we say that first, sickle cell anemia is due to the abnormal hemoglobin. Your hemoglobin is abnormal, and this is for you to know that hemoglobin is what conveys oxygen. All right, that's the part of the blood that conveys oxygen. All right, and so this is called hemoglobin S or sickle cell hemoglobin. Okay, in this, the alpha chains are normal and the beta chains are abnormal. Alpha chains are normal and beta chains are normal. Let's move to the second point. The molecules of hemoglobin S, they polymerize into long chains and precipitate inside the cells. Okay, this give red blood cells a sickle or crescent shape. Okay, long chains precipitate inside the cells, and this give red blood cells a sickle or crescent shape, and their membranes become fragile. This is one thing here, leading to excess rupture. And if you have watched our video on the destruction of red blood cell, we say that red blood cells actually last for 120 days, after which they are destroyed in the reticuloendothelial system of the spleen. Okay, and why are they destroyed is because their membranes becomes fragile. So imagine that the membrane of your red blood cell under the sickle cell anemia is just becoming so fragile, so fragile, so fragile. This can lead to so much rupture in red blood cell, okay, which is not good at all. This is another image showing red blood cells going through a blood vessel, but these are all normal red blood cells. You could see their shape. Their shape is round and they are biconcave. Okay, the middle of it is somehow deeper. They are biconcave in size. What about the third point? We say that valine substitutes glutamic acid at the sixth position of the 146 amino acid. This is the only thing that caused this sickle cell anemia. The substitution of valine, the substitution of glutamic for valine. Okay, and the 146 amino acid are actually the beta subunit, and this is what reduces the solubility of hemoglobin, and this causes sickle cell anemia. Okay, now next, I will say that sickle cell anemia occurs when a person inherits two abnormal genes from the parents. Okay, and maybe your parents is AS. Sorry, I can't type with this. Maybe your parents is AS, your mother is your father is AS, your mother is AS, and the S seems to like come together. That will give you SS. Okay, or maybe your father is SS and your mom is SS. They will give birth to all SS children, which is very, very bad. Okay, giving birth to sickle cell condition children. Next, this is a diagram of a normal blood cell, and this is a diagram of a sickle cell blood cell. Okay, it is an inherited hematological disorder in which there are abnormal mutations of the red blood cells. Okay, this is definitely deadly. All right, definitely deadly. Let's keep moving. We say that the health implications of sickle cell anemia. All right, the health implications of sickle cell anemia. We say that in children, hemolyze and sickle cell aggregate and block vessels, leading to infarction. Now, what is infarction? Infarction is stoppage of blood flow. All right, hemolyze sickle cell, hemolyze blood vessels, vessels that are broken down or ruptured. They actually aggregate together, all right, and block. Let me say this is your blood vessel. They aggregate and block your blood vessel, and this they block the blood flow. All right, and mostly in small bones that the opening is not so big. The whole bone opening can get blocked. How about ischemic pain? I would say that ischemic pain also occurs when sickle cell aggregates at the end of arteries, okay, leading to bone pains. When sickle cell aggregates at the end of arteries, this can lead to bone pains, all right, at the end of the bones, mostly in small bones, all right. Let's keep moving. I would say that the infarcted small bones in the hand and foot result in varying lengths of digits. This condition is known as foot and hand syndrome. Foot and hand syndrome. This is the infarcted red blood cells. Okay, sorry, these are the infarcted small bones where red blood cells get to like gather up in these small bones, and this can form the foot and hand syndrome. And jaundice also occurs in children. What is jaundice? We already have a video on jaundice. And there's a type of jaundice called hemolytic jaundice. Okay, this is due to the too much breakdown of blood vessels. Okay, your blood vessels are being broken down more than the usual, and this causes the accumulation of bilirubin in the body. Okay, and let me say um yeah, jaundice is as a result of accumulation of bilirubin in the body. This causes a yellowing of the skin, and yellowing of skin and yellowing of the sclera of the eye. Okay, so if you want to watch our video on jaundice, you can just go down and just scroll down to our YouTube channel, and you see our video on jaundice. Next, this is a picture of a normal cell. Okay, this is a picture of a normal cell, normal hemoglobin. And this is a picture of a sickle cell. This is the sickle cell shape that I was talking about back then. And this is a picture of the sickle cell that I was talking about then. And you can see that the hemoglobin is abnormal. Okay, you can see the sickle cell, instead of having the biconcave disc shape, it is having the sickle cell shape. Okay, and this can aggregate and block your blood vessels. Okay, this can aggregate and block small bones and everything. Okay, Now let's talk more on sickle cell. We say that sickle cell crisis occur uh crises that occur during sickle cell. If a patient is down with sickle cell, what are the crises that this patient gets to face? We say that the first crisis is VOC. This is vaso-occlusive crisis. What is vaso-occlusive crisis? Say that the hemolyzed red blood cells they form aggregates. Sorry, it's not from aggregates, okay? They form aggregates, and these aggregates block blood vessels. This is what we have here, okay? This is the sickle cell shaped blood vessels. They actually block the sickle cell cells. They actually block the arteries, they block the veins, they also aggregate in small bones, okay? And they block. And this results to ischemia. This is the cause of pain crisis, okay? Pain crisis in joints and crest. Alright? Issues of ischemia are the main causes of pain crisis in joints and chest. Next, we say there is a hyperhemolytic crisis. Now, what is a hyperhemolytic crisis? Hyperhemolytic crisis is just the rapid drop in hemoglobin level. Why is there a rapid drop in hemoglobin level? Because there's a destruction of your red blood cells, and your red blood cells are what contain the hemoglobin. So if there's a damage in the red blood cell, there will be a drop in your hemoglobin level. So first point was vaso-occlusive crisis, where we spoke about aggregation in blood vessels and small bones. And secondly, it was a hyperhemolytic crisis, where there was a drop in hemoglobin level due to the too much destruction of red blood cells. Okay. Thirdly, there will be aplastic crisis. What is aplastic crisis? We say that there is reduced production of red blood cells due to the bone marrow aplasia. Okay. If there is aggregation in your bone marrows, then of course the functions of these bone marrows will be reduced. Therefore, the production of red blood cells will also be reduced. Fourthly, there will be sequestration crisis. What is sequestration crisis? This occurs when an excess amount of blood becomes trapped in the spleen, okay, and this causes dangerous drop in blood circulating volume. When there is a large amount of blood trapped in the spleen, sorry, I'm just trying to stretch. If there's an excess amount of blood trapped in the spleen, you should know that there will be a drop in the blood circulating volume. Okay, this is another image showing the normal red blood cells and showing the sickle shaped red blood cells. Okay, this is the normal red blood cells. You could see the biconcave shape, and now you could see the sickle shape red blood cells. All right, instead of being like a disc, they are actually being straight. Okay, which is not really good for health. All right, now what are the signs and symptoms of sickle cell anemia? I would say that there's a period of pain that can last from few hours to few days, okay, due to um aggregation of blood. Okay, if your vein is blocked, and other blood cannot pass through your vein, okay, so let me say your vein is blocked and some blood are coming to pass through that very vein, and they don't have access to pass through that very vein. Trust me, you feel pain, okay? So there are periods of pain that can last from few hours to few days, okay? You could see some sickle cell anemia patients, they could be in pains for almost weeks, okay? Now there will be blood clots. Because this blood stay in one place for too long, they actually clot, and there will be swelling of hands and feet. Why will there be a swelling in hands and feet? This is because um, there is aggregation of blood mostly in small bones. And you can see that your hands and feet have many small bones. Those are your tarsals of the legs and your carpals of the hand. These are small bones that blood can actually aggregate in, and this can cause pain. And there will also be joint pains. There will be chronic neuropathic pain too. This is another image showing blood flow in a normal blood. Okay, you can see the biconcave nature of blood can is the reason why this blood can actually, will I say, squeeze through blood vessels. Okay, but when you have sickle cell shaped blood, when you have sickle cell shaped blood, their shape don't really allow for that maneuver. Okay, the sickle cell shapes don't allow for maneuver through blood vessels, and this can cause aggregation. Okay, the blood vessels actually aggregate and can block completely a blood vessel, and there will be no blood flow again in that blood vessel, this resulting into pain that we spoke about. Okay, and next, what is the treatment of sickle cell anemia? You know that in the medical career, once we talk about illnesses, we next will talk about how to treat them. Okay, so what is the treatment of sickle cell anemia? We'll be talking about the treatment of sickle cell anemia. I will say that there's hyperhydration. Okay, hyperhydration. This hyperhydration is known to relieve ischemic pain. Hyperhydration, I think it is like intake of water in large quantity. And there's hydroxyurea. Okay, and hydroxyurea will release the number of attacks. Okay, and there's voxylator. Okay, so these are the known treatments of sickle cell anemia. But the most classical treatment, I don't know if they have explored it, will be since there is a replacement of glutamic by valine. Okay, the most classical treatment of sickle cell anemia will be the replace of valine by the normal glutamic acid that is supposed to be on that 146 amino acid chain. Okay, so with this we have come to the end of our tutorial on sickle cell anemia, the pathophysiology of sickle cell anemia, and I hope you guys enjoyed this. If you enjoyed this video, just hit the subscription button on my YouTube channel, and see you guys in the next tutorial. Bye for now, guys.